Thank you, Hendricks. With good intentions, I'm actually going to keep us on time so that we can start the next panel. So that gives us about 5 minutes for discussion or comments, and we'll start with a couple of questions from the forum membership. Peggy?
Hi, Hendricks. Thank you very much. It was a great presentation, and it touched on a lot of the issues that are raised in this type of research. And at NIH, while we hate the word program evaluation, we are now using terms like implementation research, and dissemination science is one of the newest ones. I think that kind of justifies our role in getting involved in funding these types of studies. But my question to you is, while some of the value for this is going to be in knowing about the generalizability of an intervention and how well it works, its efficacy, and I should say effectiveness probably, but also, there's local benefits from knowing exactly how the program is delivered, how it could be tweaked for that particular local problem. And so I'm wondering who should pay? Who should pay for the evaluation? It's not necessarily the federal government's responsibility or NIH's responsibility to pay for every program evaluation, but at the same time, we know that local communities say, well, we can't even afford to do it then if you're going to make us pay. So I was wondering, you probably have some wisdom about this, having been involved in it for as long as you have.
Well, part of it is, so that's a complicated question. One of the things you can think about is looking at the organizations that are responsible for delivering the services. SAMHSA, for example, in the United States, the Substance Abuse and Mental Health Services Administration, is prohibited by law from doing research. But they also have some major steps in here. Every single grant that they have requires a sustainability plan. There's no problem with having that sustainability plan be part of a evaluation. Where are you at this particular point, and where is it locally going? And I think that's doable integrated into those kind of projects like that. I think it's it does raise this issue of sustainability. I think we need a mechanism that we can feed back information. And in many of the interventions that people are starting to think about now have to do with interventions that are dealing with e-health and m-health interventions. There's a very nice natural kind of evaluation process that you can do by collecting information during those settings in here and using those as for evaluation. But I think I should open it up to other people who have other opinions about that.
Michael?
Having done evaluation of suicide programs a lot, everybody wants to use suicide ideation as the intermediate variable to determine the effectiveness of some program for preventing suicide. And I don't think this works. I think suicide ideation is a very weak predictor of suicide. It's a predictor of distress and a predictor of other issues, especially in youth. But so many programs, because of the problem of sample size, and ideation is common. The problem is ideation changes week from week, and whether or not it actually predicts suicidal behavior or particular suicidal death is very weak. And so selecting those, it's easy to select intermediate variables that are common, but one really needs to be sure that they predict your ultimate outcome. And that's something that in many of the studies I see and review hasn't been thought. They said, oh, ideation, of course it reflects suicide. And it simply doesn't.
Right. We don't typically use ideation alone. Most of what we look at right now is attempts, serious attempts. It is not easy, but it is possible to go through human subjects and get large amounts of information around suicide attempts now, self-reported information. It's obviously difficult to get that, in terms of even obtaining all of the information about accounts for all of the medically treated attempts as well.
Thank you. Valerie, and then Bridget will have the last question.
For that presentation. I'm really intrigued with the rollout design, and I think it addresses an important component of evaluation, and that's community buy-in. You've got already that engagement and that buy-in. But I wonder, just in looking at how you enroll the various clusters of schools into the evaluation, what happens when you have, especially in school districts, the traditional leadership change and all those sorts of
Right.
things? How, budgets being changed, how do you get all the schools into the implementation of the intervention?
Yeah, you really pointed out the main issues of school districts, that all of these school districts, all of these organizations, including primary care, everything else is changing rapidly. And David Chambers has just written about this kind of sustainability framework model for looking at the systems that get changed as well as fast as your study is going on in here. What we put together in there was a partnership that was sustainable across the administrator. The administrator actually was fired on a weekend, which is a typical thing that happens. We had very strong ties with the school district, the school board, and that was what kept us in the advocates. So we had a plan for how to maintain our consistency across that, and we were able to.
Thank you. And Bridget, if you could.
Sure. I don't actually have a question. I have a comment and a thank you to the committee for including this kind of presentation that you gave, which I think was excellent, and giving us enough time to really digest what you were saying. I think, this topic of violence and mental health and violence and some of the other topics that we've struggled with really lends itself to expanding beyond the randomized clinical trial and what we think of as evidence-based practice into other territory, which I think has also been named practice-based evidence, which is where we bring back learnings as we're doing them. And I think seeing them as complementary approaches to really looking at how do we figure out if we're doing the right thing,
Right.
that we aren't doing harms, is important, and raising this to the level of conversation for other scientists to see the value is really critical. So I appreciate what you gave and brought to us today. Thank you.
Sure, thank you. And, I think these two directions need to come together and integrate in here. Larry Palenkas and our group from USC has been talking about this as through cultural exchange theory. It really is. We need to learn from each other and be part of this kind of joint approach. So thanks.
So please join me in thanking Hendricks for this excellent and important presentation.
Thank you so much.
We also invite Mark Rosenberg and the members of the last panel to come on up and get started.